How is a nasogastric tube removed? Have you ever wondered how a nasogastric tube is removed from a pet? This common veterinary procedure is essential for various medical treatments. Let's break down the steps involved in this process. When it comes to removing a nasogastric tube, timing is key. If the tube has been in place for less than 16 weeks, the removal is usually straightforward. The first step is to position the animal on its right side, which is known as right lateral recumbency. This position helps facilitate the removal process. Next, the veterinarian will gently grasp the tube close to the body wall. This technique minimizes discomfort and reduces the risk of damaging surrounding tissues. Before starting the removal, it is important that the pet has been fasted. This precaution helps prevent any regurgitation or aspiration during the procedure. To catch any gastric contents that may come out with the tube, a towel can be placed over the tube site. This simple step can make the process cleaner and more comfortable for everyone involved. However, if the nasogastric tube has been in place for longer than 16 weeks, the situation becomes a bit more complicated. There is a higher risk that the tube may break during removal. If this happens, parts of the tube could remain inside the animal. Larger pets may be able to pass any retained fragments naturally. But for smaller pets, a more advanced method may be necessary. In such cases, endoscopic retrieval is often the solution. This procedure involves cutting the tube at the skin level and pushing the remaining portion into the stomach. Then, an endoscope with grabbers is used to retrieve the tube through the esophagus. This method typically requires sedation or anesthesia to ensure the pet is comfortable and calm during the process. Throughout the removal, the veterinarian must be careful and consistent to avoid causing trauma to the animal. The comfort and safety of the pet are always the top priorities. Depending on the pet's temperament and condition, sedation may be considered to make the experience less stressful. After the tube has been removed, monitoring the site is essential. The veterinarian will check for any signs of infection or complications. This follow-up care is crucial to ensure the pet's health and well-being. In summary, removing a nasogastric tube is usually a simple process if done within a few weeks of placement. For longer-term tubes, more advanced techniques may be required. Proper preparation, positioning, and post-removal care are vital for a safe and effective procedure.